I'm Marjorie Morrison.
And I'm Patrick Kennedy.
And you are listening to the Psych Hub podcast, the future of mental health. Hi, everybody. Welcome back to the show. We have another really interesting, fascinating, and exciting podcast for you today. Today, you're going to meet Captain Matt Kliman, and he is an officer in the United States Public Health Service with an assignment to the National Guard Bureau as the Director of Psychological Health. If many of you are like me, you don't know a lot about the military. And I don't mean that to be condescending. I spent over a decade working with that population, but I didn't know anything when I went into it. So to put it in context, we have 1%, actually less than 1% of our country serving in the military. About 10% are military connected. So we consider those a family member or a veteran, but that leaves 90% of people like myself that don't know this population and don't know anything about them. And you know what? It's not entirely our fault. The military is a very separate world and it's very confusing. There's different branches of the military and they all do different things. But I find the National Guard Bureau one of the most fascinating because the Guard straddles between civilians, like everybody, just the average Americans, and the military. So when you hear about civil unrest and you'll hear about the National Guard Bureau is coming up. So these are the guardsmen. They show up at like domestic times. They show up at times of natural disasters. And they also will get deployed and go with the military and to help them. So they're an interesting group. At the same time, they might be just one of your coworkers and, not seem any different in that they're not wearing a uniform when they're in their civilian day jobs and they're basically, going to drill on the weekends. So they just have this interesting dichotomy of the two worlds. The reserve has seen a decrease in suicide, which many of you know are increasing in many other places. But they did show a decrease, which is really encouraging. They went from 81 suicides in 2019 to 65, but they're still struggling and they're a very vulnerable group because they don't always fit into one or the other. I think you're going to really enjoy this conversation and you're going to learn a lot from Captain Kliman because he's pretty innovative. He thinks about things in an innovative way. So when we think about the future of mental health, his work and the work that the Guard Bureau does is putting us on that path for the future. He, believe it or not, his programs support more than 450,000 members and their families. And he does it through a bunch of different ways, like fitness, resilience, and wellness. So I'm excited to share this conversation with you. And I'm excited for you to learn a little bit about this great community of the National Guard. Before we get started, I just wanted to say thank you so much for your service, Captain Kliman, and for taking some time to be with us today.
It's my honor to be here, Marjorie. Thank you so much for that kind intro. And I'm really excited to talk to you all today about some of what we're doing in the Guard and just my personal interest and passion in mental health and kind of the journey that led me here. So thank you again for having me on. This is quite an honor.
I have had the opportunity to get to know Captain Kliman a little bit over the years, and he's always one that leans in and really he leads from a place of heart and soul and then follows up with really great execution. Before we dive in, I was wondering if you wouldn't mind, for those that are listening that might not be familiar with the National Guard and how it differs from other branches of the military, because I think that why we were so interested, Patrick and I, in talking to the National Guard is that the National Guard straddles this very unique role between civilian culture and military members and service members. So could you help kind of give a lay of the land for us?
Yeah, that's a great first question. And it's an important one because I think you have to have an understanding of the population that you're kind of serving when you're in a strategic role and when you're directing an enterprise-wide system of psychological health support, kind of understanding the nature of that population is really critical. So the National Guard, as you mentioned, Marjorie, it's got 450,000 service members. and that doesn't include families. So that's it's about 1/5 of the entire U.S. military. And the unique nature of the Guard is about 80% of those serving have regular jobs. They are not in uniform 365 days a year. Their eligibility for access to care is really dependent often on the job they have in their local communities. And so when you think about the kind of the concept of like a weekend warrior, which is what a lot of people hear about when they think of the Guard and Reserve, it's these individuals who have stepped forward to serve, but they balance kind of a life within their community, working within their community, and also serving their country in the Guard. And so they drill on weekends. They're often deployed either domestically or overseas for extended periods of time. So again, having to kind of balance their family life and their work life with their service to their country can really be an interesting test of resilience for individuals and families. And the geographic dispersion of the Guard is something that's very different from the active component. So when you think about the military, you think about like military bases and posts, and if someone gets sick, they go to a military treatment facility to get care. The Guard doesn't really work that way. So there are certain Guard members that, for example, who live in the DC area who may have access to military providers, but many of the population lives in very rural communities. So they're very dispersed. Sometimes mental health care isn't readily available in their where they live. And even if it is available, sometimes they don't have access to it because of insurance, lack of insurance, or no other way to be seen. So in a strategic role, we constantly are thinking about ways to get services to those who need it, kind of differently from how maybe the military would look at it when you've got service members who have brick and mortar facilities kind of at their disposal. They could just walk in at any time. Those are just a few of the challenges, but there's a lot. And again, there's that state and federal mission too with the Guard. So Guards can deploy under the authority of the governor and the adjutant general within the state. So when you think about what's going on in our country right now, with like a lot of the civil unrest, for example, the wildfires, these kinds of incidents that occur domestically, the Guard is on the front line. COVID obviously comes to mind, of course, but there's lots of these things that are happening across the country, and the Guard is always one of the first to be called to support. But then they're also part of the strategic reserve for the military, so they can also deploy overseas into combat situations. And again, all of that is to say, coming up with a strategic approach to how to support this population is very complex and nuanced. So it takes the effort of a lot of really smart people who are working these issues every day to make sure that they have the care they need.
Thank you, Captain Kleiman. I think you hit the nail on the head in terms of the services that can be procured by our Guard and Reservists when they return to civilian duty. It's really contingent upon the health plan of the employer that they work for.
Right.
One of the things that's been really troubling to me is after Iraq and Afghanistan, obviously the signature wounds of war, traumatic brain injury, post-traumatic stress are key, and yet many health plans, as you point out, do not fully cover these benefits. And it's really striking to me because I would think any one of these Fortune 500 companies, if they knew in a sense they were denying access to one of our heroes, who, by the way, needs the help because of their service to all of us, there's something entirely inconsistent about that. So I've really thought about what ways we in the federal government and so forth can really, I don't know, through maybe the relationship that we have with employers, really try to push this notion, if not just connect them to ongoing care through the VA or, as you said, other DoD facilities. But that's really difficult, isn't it? Because when a member of the Guard leaves their active duty, many of them don't want to be screened, correct, for
Right.
anything, because that might mean they have to spend an additional month uh, in uniform when they really just want to get home to their families. So that might make it even more difficult for them to access the follow-on care. Could you talk a little about that?
Sure. I mean, that is something we deal with regularly. It's one of the concepts that I became very familiar with when I started this assignment 4 years ago is the idea of intentional redundancy. And with the Guard population, that becomes critical because there's so many outlets that could be available to a service member that not everyone is going to feel comfortable, as you mentioned, accessing or have eligibility to access, that we have to set up our programs to be almost intentionally redundant. So you mentioned the VA, for example. We have a partnership with the VAs to leverage their vet centers. So, of course, not every Guard member has access to VA services. So if you haven't federally deployed for like 180 days consecutively, you may not have access to the VA. But what the vet centers do is they provide kind of that on the ground support. So the MOU that we signed with them brings these mobile vet centers onto drill weekends. So all Guard members, regardless of their status, can walk in, get information and referral services or potentially counseling on a number of topics like relationships or financial issues or stress related to their job. And of course, not everyone's going to do that. Not everyone wants to walk into a vet center to get that kind of help. But by setting this up in a way where it's very visible, you've got everything from getting benefit information about your benefits that you could potentially receive to, again, services about financial counseling. It destigmatizes mental health. I mean, so from our perspective, when we're working with our community partners and with our federal partners, we don't want to set up a system where someone has to go through the back door to get mental health services. I mean, the whole idea has been, this is part of a holistic model where the earlier you access care in that spectrum, the better off you're going to be. And I mean, to your point, if someone is feeling like they don't want to do the things they need to do to put themselves in a situation where they're talking to a helping professional when they need it, it's just going to continue to become expounded and exacerbate to the point where they're not going to have a choice. And so, we've set up other programs with, nonprofits. Like, we have an MOU with Psych Armor, with Psych Hub. We've got an MOU with Give an Hour, with Cohen Veterans Network. These are all organizations that provide training to community providers, that provide free pro bono counseling to service members, including National Guard. We work at the local level. We have directors of psychological health that work within each state to become familiar with what's available locally. So, I mean, I could go on for a while, but from our perspective, it's not a one size fits all approach. We have to work very redundantly to make sure that someone who needs help can get it.
That's really well put. My fire is that we do not enforce the federal Mental Health Parity and Addiction Equity Act, which I had the honor of authoring when I was in Congress. And it seems to me adding insult to injury that we do not enforce this when so many people that would be covered are a Guard and Reserve, as I said, because they wouldn't otherwise qualify for other services. So that just, and I'm really shocked that we haven't been able to make that a bigger part of our case for parity enforcement. But to your point about going into the vet centers, in Rhode Island, we found that just the Guard kind of coming back more regularly for weekend drills or what have you really helped. I don't know what studies these were, reduce stress and post-traumatic stress amongst the Guard, because there was so much power to the peer relationship, especially if those units were deployed with each other.
Right.
We had a high military police deployment in Rhode Island, but when we had them come back, they didn't need as much of the outside services, because part of the disconnect is they never felt understood by the civilian service providers who didn't really relate to the kinds of experiences that they had had, for example, in Iraq and Afghanistan. But just being around each other, if the adjunct general in the state, made a point of calling them back more regularly, kind of innocuously, not to tell them that this was the primary purpose, right?
Right.
But as far as, quote, readiness, right, they found that there was a lot to be said for the benefit that those guardmen and women were able to benefit from being around each other again.
So, it makes me think when you describe that, a lot of folks talk about one of the challenges that the Guard has is that they're not together 24/7 the way the active component. So, you may deploy together, but then you go back to your community and you may not see your fellow soldier or airman for another month or longer. So that can be a challenge, but it can also be a strength because, as you mentioned, if you live, in Rhode Island, or if you're in a state and you've been drilling with the same unit for years, you form a bond that lasts over time, as opposed to, say, the active component where they're moving around every 2 to 3 years. So a lot of those ties become almost like family. And you'll also often hear that with the National Guard. It is kind of like an extended family. And so when you bring folks back together, it can be very powerful. And also similar to how, when you haven't seen your grandkids or, your nephew or your nieces in a while, you always notice things that you wouldn't necessarily notice if you're seeing them every day. So I remember, when my kids were younger, my parents would come in to see them a couple times a year, and they would always comment how much they've grown or how they look so different. And in my mind, they didn't look different. They look the same. And so I think when you apply that to the National Guard, if someone is struggling and if someone's going through something difficult, if they've had a change in their appearance or a change in their personality, the Guard is actually in a position where they can maybe notice some of those things before others, because they're getting those snapshots every 30 days. So I think it's really critical to have those events that you're talking about where we bring our folks together and we equip them to be able to recognize when someone is maybe struggling. I mean, this isn't a problem that only clinicians can solve. We know that. It has to be, peers need to be engaged, leadership has to be engaged. A lot of what we do from a strategic initiative standpoint is providing that level of training and awareness to units so that they can take care of each other.
Tell me a little bit about when you get out from after having an active deployment, because I'm told, like with our units in Rhode Island, they went through Fort Dix and they'd have to sign some kind of waiver that said that, they weren't check, suffering from post-traumatic stress or anything like that, because if they said yes, they'd have to stay in an additional
Right.
month or something. What can you fill our audience in a little bit on that? Because it kind of works against the notion of a more accurate assessment of how a person is doing. If they were to be honest, they prolong the time that they're away from their family.
Well, that is true, but I'll say this, and it's a tough question to answer because every state does it a little bit differently. And so the consistency of how the Guard does that, it kind of varies between states and sometimes between units. The Guard has the Air Guard and the Army Guard. So again, if you are in a particular geographic state, but you've got an airman versus a soldier, they may, have a completely different experience. So it's tough to give one answer to that question, but I will say when we're talking mental health, what I've seen is oftentimes those kinds of signs and symptoms don't always appear right away. So I think what tends to be the case is an individual comes back, they just want to go and see their family. So as you point out, they're kind of motivated to just get home. They don't want to stay any longer than they have to. But what's important is that we build in a process where we're doing regular checks. So just because someone says they're fine immediately following a deployment doesn't mean that we shouldn't check on that individual regularly and have those kinds of kind of built-in processes. So, 6 months from now, how are they doing? And I'll give you a really good example, a relevant one with COVID. So you had Guard members in New York activated, during the spike in New York back in the spring. And so you had Guard members that had not really been trained on a lot of these kinds of difficult mission sets, doing jobs like body retrieval, pulling dead bodies out of a house that had deceased from COVID, and clearly traumatic. And so we know that these are individuals that are probably going to need some kind of support. So what we're doing kind of at the strategic level is we're actually building a process where we go back, 3 months, 6 months, 9 months, and 12 months and check on those individuals, follow up with surveys, work with leadership within the state so that they know kind of the questions to ask and how to direct them to help. So to me, kind of comprehensively, you want to make sure that you're not, just because you might have missed a mark, you haven't lost an opportunity to help that individual. They're still going to be a member of the Guard. They're still going to be coming to drill every month. Mm-hmm. And so there's multiple opportunities to provide assistance. But to your original point, I mean, it's, we do have to work at the state level to make sure that we're not inadvertently stigmatizing help-seeking behavior or inadvertently disincentivizing help-seeking behavior. So that's an ongoing challenge.
In Rhode Island, we had the school committees need to talk to the teachers within the schools where the children of Guard and reservists were who had served in Afghanistan or Iraq, because of course the kids are traumatized by, at the time, seeing all the graphic pictures on the news. And in many cases, these children were much more likely to be disciplined, as opposed to having the principal and the teachers in the school know that their father or mother was serving over in Iraq and Afghanistan. Mm-hmm. And so I'm just pointing this out to our listeners because there's so many dimensions to this that impact those who wear the uniform that are totally missed by the general public. And I honestly my eyes were opened up when I thought about the secondary trauma of these families who lose their loved one for prolonged periods, many repeated tours, and then, try to cope. And of course, are left with a lot more challenges. And the civilian sector isn't adept at knowing how to best support those families.
So one of the things that, surprises me almost every day is just how resilient our members are. I mean, it's pretty amazing when you think about, what the average family in the United States might experience, on a given day, whether it's in the middle of our, this pandemic that we're in right now, or just stress related to employment or finances or, relationships. And then you look at the military population and the Guard specifically, and you add on top of that some of the very unique things that make the Guard kind of stand out from the rest of the country, which is someone just, if you deploy, you may not be getting paid in your job. So not only are you leaving, but your income is potentially going to take a hit. And so when we think about we talk about resilience a lot. It's almost become like a buzzword, but Guard families tend to be very resilient by nature. And so one of the challenges at the strategic level is how do you leverage that resilience, that fitness, if you want to use that term, in order to be able to resonate so the programs that we put in place will sort of resonate across our total force. So it kind of moves away from that model of mental health as a disease where someone gets broken because they've been through this extremely stressful experience and now they have to go and talk to someone so they can be fixed. And it really, from my perspective, our challenge is how do we take this concept of fitness and wellness and resilience that our population has, and how do we capture that in the initiatives that we promote, so that we're essentially saying what makes you so good at what you do is your fitness, but your fitness has to be measured across a number of domains. It's not just how physically strong you are, but it's how you're able to kind of respond to those kinds of stressors, how you're able to deal with kind of your social resilience, your behavioral and emotional resilience. And so we've really taken that model and we've tried to promote it as a way to sort of destigmatize mental health, but also leverage what we know is effective within our population, which is this is a resilient group to start with. So let's start with the strength, and how can we use that to some strategic advantage to, promote wellness across our Guard. And it's a challenge. It's definitely a challenge, but we're seeing the needle move some, so that's encouraging.
I have to say, I'm so grateful that the Guard thinks about it like that, because you're speaking like the language that we think about is, how do you get to people earlier? How do you, catch some of these things at an earlier stage? And I want to comment on your earlier comment about that it's okay at that exit point of going back home. If you miss that one window, that's not the only window, is that, different people kind of enter into what could be such a critical time for getting help at multiple different times. From what I hear, and you could tell me whether or not this is true, I've heard that the National Guard has the highest suicide rate right now in the total force, that it's about 30.6 per 100,000 people. So that's pretty high. We know that we're seeing high suicides everywhere. So I would imagine that everything we've talked about so far has made that number be what it is, or as complicated as it is. It sounds like there's a new warrior resiliency program that you're heading up. So I'd love for you to tell us, some of these things. We know you guys are doing everything you can. So what have you kind of learned? What are you planning? What are your thoughts around that?
Well, yeah, I'd love to talk about that. But first, I do want to point out that that 30.6 number that you referred to, Marjorie, that's actually a 2018 stat. And so, our division of Warrior Resilience and Fitness stood up last July. And so, we've been in existence now for about a year and a half. And our 2019 numbers were considerably lower. So we actually, they just released the annual suicide report just earlier this month. And so the Guard, I believe, was the only service with a statistically significant drop. So we were down to about 20. I don't have the numbers in front of me, so I can get back to you on but it's about 20 per 100,000, which again puts the Guard right, kind of on the, certainly, one suicide is too many, but when you're looking at suicide and when you're counting the number of lives lost every year, to see that number go down is something that we can certainly appreciate. So, and the timing of that, sort of as we're standing up this new holistic approach within the Guard, it's fortunate that we can start to tie some of our strategic efforts to outcomes. So, again, counting suicides isn't always the best way to do that. But when we look at, issues that are impacting our population, one of the things that we're trying to do within our Warrior Resilience and Fitness office at NGB, the National Guard Bureau, is how do we measure impact, not just from the sense of adverse outcomes, but what are the actual behaviors we're trying to change at the community level? So we're really interested in data. We're really interested in knowing how the Guard mirrors their local populations so that we can put programs in place that actually get after the specific issues that are impacting a geographic area. So, if you put a program in place in Montana, that may look a little bit different than New York, just because the factors that they deal with are much different. So we've really built our entire strategic approach around, kind of identifying where our problem areas are and where our strengths are, and then catering those strategic efforts to try to resolve those kinds of local issues that are impacting the population. And man, I could talk all day about it, Marjorie. But a couple things that we're doing, which you may know about, the Guard is a great test bed for piloting new programs, because you've got 54 distinct states and territories that are led by a governor and an adjutant general who all want to show that what they're doing is effective. So we've been able to work across the 54 to pilot emerging and best practices in order to kind of inform our broader strategic efforts. So right now we've got 29 pilots that we're 22 pilots across 29 states that we're currently supporting at the Guard Bureau. And what we want to do, for example, if you have several states that are looking at doing some kind of virtual telehealth or mental health virtually, we want to consistently measure those programs to see which one is more effective. And then we want to work with those states so that each of the states that are doing it can improve their efforts based on what they're learning from themselves and from others. And then once we figure out what right looks like, we want to be able to leverage that across the entire National Guard into our strategic approach. So if you think about, we've got 29 states engaged in that right now.
Wow.
Called the Innovation Incubator. So we're incubating these kinds of innovative approaches. And then what works well, we'll be able to expand those programs to benefit the entire 450,000 that serve in the Guard. So, so again, it's kind of using analytics and metrics and finding best practices, promoting those, testing, and then expanding the ones that seem to be most effective.
So, Captain, you talked a lot about how we often have this negative narrative when we talk about mental health, and you really set us straight, because it's the big challenge to tackle stigma is to not look at this simply through a negative lens, but as it's often looked at in the military as a, quote, force multiplier.
Mm-hmm.
In other words, if you're able to get additional abilities to mediate stress, thoughts, mood, and then be able to continue with an action in spite of, you just have become the kind of stronger person for all of it that we in society all want to kind of strive for as well. So talk a little bit about how you're preparing the Guard to manage stress before they go into a potential situation. You mentioned the New York, they weren't quite prepared. How are you kind of moving forward with this new office that you're leading there to try to harness kind of best resiliency kind of trainings in anticipation of future events, as opposed to just thinking about this as something that you capture after the fact?
Sure. It's a good question. I mean, I think for us, part of the solution at the strategic level, and keep in mind, I mean, there's a big difference when you're working kind of at a headquarters level policy and strategy shop, and how the Guard kind of at the local level actually implements programs. So one of the things that we really care about right now is how can we influence what's happening locally? Like, how do our policies and our strategic position on a topic, how does that actually translate into something that's going to impact the service member? And that, I mean, that sounds like kind of a common sense statement that I just made, but, and you guys know this better than anyone, but that doesn't always happen, right? At headquarters level functions, sometimes these programs just exist in a vacuum, and they're not really affecting or impacting those that need it the most. So we've tried to invest in initiatives that actually have a direct impact, whether it's how we train our community level providers. And I'll just kind of start with that, because since the Guard doesn't rely heavily on internal providers to do their care, we have to really lean heavily on our local communities, whether it be through TRICARE or through other organizations that provide counseling support. It's really critical that those providers at the local level have the skills to be able to appropriately engage with our population. I mean, if someone goes to get help, if they know they have a deployment coming up, and they go, as we keep telling them, you should go, don't wait until you're in a crisis, go and talk to someone, put a plan in place, make sure that you got everything there. And that community provider doesn't understand what it means to serve in the military, or what it means to kind of wear a uniform, if they don't understand the rank structure, or they don't understand military treatment protocols. Like, so if someone is dealing with like PTSD or some issue that's very common within the military, but they don't have a lot of experience, then that's the quickest way to turn someone off to not going back to get help. So we've really invested in initiatives that train community level providers to be able to better understand the nature of what our population deals with, and to be able to understand those treatment protocols for those kinds of issues. We've got multiple trainings that are occurring throughout the year where community level providers can come in and actually get free training. It's a 3-tiered approach where the kind of tier 1 is they get to understand sort of the basic military culture. And then if they get through that, then tier 2 is they start getting more training about actual military issues that could be impactful from a mental health standpoint. And then the third level of that would obviously be treatment protocols, like cognitive processing therapy, CPT, those kinds of things that have been effective. So I know that doesn't directly answer your whole question, but from my perspective, we have to invest at a national level in local programs and providers that can actually make an impact. And that's why working with our local partners, state partners, we have multiple engagements where we're actually seeing what works at the local level so that we can expand that to the broader population. And it's really, it's almost like it's tedious work because you solve a problem in one state and then you got to still make sure that what you're doing is going to work across the other 49 or the other 53. And so I think, it's not a problem that can only be solved by clinicians. We know that we've got to get leaders behind this. And, we have to have the support of not only our national leaders, but kind of at the state level, at the unit level. And so again, we spend a lot of our time doing that. It's been challenging this year with COVID, but we're finding ways to have those connections across the country, at every level.
Can you talk a little bit about your experience with the Homeland Security? Because it was always surprising to me. We had this department get created in the wake of 9/11, and terror is a psychological weapon of war. It's the purpose of terrorism, and yet we have very little preparation, it seems to me, as kind of a civil response to these attacks in terms of educating our general public on how not to respond in a way that kind of confirms the reason why terrorists want to attack us. And it would seem to me it kind of starts within the military to be appreciative of the fact that this is really a weapon of war. And that we have to build the proper coping mechanisms to not to respond to terror in the way that our fight or flight response normally would dictate. But to what extent have you seen through both Homeland Security and your current position where we're starting to wrap our arms around this as really the weapon of war for asymmetric warfare against us?
Psychological operations are, there's a whole field of study on that now and how that impacts. I worked obviously was with the Coast Guard for 6 years. I spent a few years at Homeland Security looking at this and mostly kind of the first responder community. So Custom and Border Patrol and, TSA and Secret Service. And so you're right. Certainly it's hard to give an answer that's going to encompass all of that. But my experience has been, we've got to understand sort of how the mind, body, and spirit kind of play together to determine our, ability to be fit to do the job that needs to be done. And I think I say that because, people understand the sort of the physical impacts way before they understand the psychological impacts of what you're describing. So, you talk about something like, if you're not sleeping, what does that do? If you're not well rested, if you're using a substance that may be impacting your ability to think clearly, if you're on a particular medication, or if you're not able to kind of go to work at 100%. And I think what the work that I've been doing for the last 10 years or so has been to try to bridge the gap between mental health and physical health. So a lot of the symptoms that you describe when someone who's not physically healthy, when you look at the actual impact and how that can be measured, there is no difference in how that individual's mental health impacts those same physical symptoms. And an example of that in the military, at least, would be looking at the soldier or the airman as a human weapon system. If you think about it, what is their job in the military? It's to put weapons on target. It's to, you identify what the problem is, and then you've got to basically, you've got a job to do to make sure that you're impacting that problem the way that it needs to be impacted. So if you have an actual weapon system that's not calibrated and the weapons aren't hitting the target, that's a huge problem. And so when we think about, the idea of psychological operations and how that impacts our ability to put weapons on target in a human way to do the job that needs to be done, of course we should be investing in that. We should be investing in all the things we need to do to calibrate ourselves to be at our best. And another analogy that I like to use is looking at like a sports psychologist, someone who takes an elite athlete, for example, someone like Tiger Woods in golf, maybe. And if he goes to a sports psychologist to get an edge in competition, he's already an elite athlete, but how does he get an edge to perform even better? Nobody sees that as well, what's wrong with him? It's like, of course,
Right.
You're going to leverage everything you can do to be able to perform at your highest level. And much of that is just how you psychologically perform under times of stress. So I think, taking an approach like that, it helps with the stigma. So no one sees that as a problem if you're going and trying to find an edge to become more elite at what you do. But it's also just a way to promote a more holistic approach overall. So again, not waiting until your problems are so bad that you're misfiring, but just doing those system checks periodically. So that's something that I've kind of been thinking about a lot, from the time that I was with Homeland Security, working with first responders, working with Coast Guard, even my time in the Air Force, to be honest, doing clinical work, a lot of the things that I saw clinically with my patients who were struggling on some level, it's that sort of putting a problem-solving technique in place that works very well at the strategic level too. And I think that's what I've seen in the last 20 years or so is an effective strategy is an effective strategy, whether it's at the individual level or for a population of 450,000. It's really trying to understand what the problem is and then putting solutions in place that are going to, get us to the end state that we're trying to get. So, I mean, again, I apologize if I didn't fully answer that question, but I'm just trying to think of a way to answer that sort of bridges all of those different, situations that I've seen over the course of my career, very different jobs, but in some ways all very similar.
Well, I love the metaphor you use because it's so graphic, and this is military readiness. And this is not, as some people would think of it, as some kind of soft side or extracurricular, so to speak. This is essential stuff, because the demands on our forces today are so multifaceted. It's not like going into a battlefield, oh, there's your enemy, take them out. It's, you're working within urban areas, you're working with all kinds of, as I said, kind of asymmetric battles, and you need to be able to process information efficiently or else you kind of jeopardize the mission. So this is really not about mental health in that respect, but it's really about preparedness, like you said. I mean, I think that sports psychologist metaphor as well was very, very apt for the audience to understand exactly what we're trying to get at.
Yeah, and it's whether it's going to the gym or doing meditation, learning how to control your breathing, learning, doing yoga, something to help sort of, with your flexibility, your balance, with your ability to kind of stay balanced, both kind of in that mind, body, spirit level. All of those activities are really trying to get you to the same point. And I think, again, when you think of the military, you tend to think of these very physically fit individuals that are going out there and fighting a war. But the kinds of missions that we're engaged in right now, physical fitness is only a very small percentage of the overall fitness that you need to be successful. So I think that's the challenge within the mental health community right now, is to reframe that conversation so that we're not talking about something separate. We're talking about something very much included in how we evaluate the total fitness and wellness of our population. So I think it's very, very relevant when you're having that discussion.
And it's so good to get the rest of civilian society to understand that for you all to be effective, we have to start early, which means it's the military's objective to also focus not just on the fact we have an obesity crisis, which makes it more difficult for us to get the number of soldiers that we need, but also, to inculcate this kind of problem solving skill, coping mechanism development early on, because our military readiness depends on it. And if we were able to see that connection between a strong kind of young cohort of people that are going to end up in the military and military readiness itself, you might get a broader buy-in, frankly. This is purely on my side as a partisan, to earlier investments in building up strong minds and strong bodies amongst our youth. So
we've invested a lot of resources into not just taking our population and trying to make them healthier, but going back as far as what do we do for those recruits that are coming in? It's interesting. I read a few years ago that, when suicide started to spike, several years ago in the military, there was this assumption that it was around increased deployments. There was a lot of, especially with back in the early 2000s, when all of the deployments were kind of ramping up, we saw, a spike in suicides. And so there was actually a lot of research done. And what they found was that there really wasn't a correlation between deployment and suicide. The correlation had to do with the recruits that were coming in. And there was because as we needed to increase our recruiting activity, recruiting standards started to drop.
Wow.
And so individuals coming into the military were actually maybe would not have been able to make the cut, 5 years prior to that. And so they were coming in with a lot of issues, a lot of problems, a lot of early adverse, childhood experiences and trauma. And that their resilience was frankly lower. And that was what was kind of leading to suicide. So it sort of changed the paradigm a little bit for us, which is, it's not just about taking this healthy individual who's coming in, but it's really meeting them where they're at. And it starts with recruiting, how we train those recruits. We've got a number of initiatives right now aimed at that group. And again, getting services in place really early. And we found that there is a correlation between the earlier you get services in place for those recruits, the more likely they are to complete training, to actually become commissioned or to go into the service, and the less likely they are to need mental health treatment later on. So it's smart to invest in that, for a number of reasons. But we've certainly seen that in society overall, suicides are going up, resiliency seems to be going down, and that's a population that we are recruiting from. So we have to acknowledge that.
Really well said. Yeah. General Corelli is a friend and obviously ran that STARS and really, what incredible findings, because it was so counterintuitive, like you said, to what people expected. And they also tested, with the TBI being such a significant, signature wound of war, that many of the young people coming in had played active sports, had multiple TBIs even before they hit the battlefield. Yeah. And that TBI can kind of be effect of multiple incidences. And if you already got, your clock run a couple times before, then you're in theater and an additional one happens, it can mean a whole lot different than someone who's never had that before. So, data, like you said, is really key to us understanding how to better, help people who need the help, who are serving our country.
Yeah. And, to your point, if we're not training our providers appropriately, you've got TBI can be a huge factor in someone's overall wellness. But if those providers aren't being trained on that, they don't even know what they're looking for, and, right. If you go into a mental health provider and they aren't trained to be able to detect those kinds of, and it's subtle, with TBI, it can look a lot like other things. It can look like depression. It can look like some other, more common areas. If you go to a barber and ask if you need a haircut, they're usually going to say yes. So it's kind of like if you have to know what you're looking for and who you're asking. So social workers and psychologists who have the best of intentions to provide quality care still need to understand that it can be very complex, and that their training needs to be very nuanced to really look at those specific issues that are impacting our military population. And it's an ongoing battle for us to be able to, not only kind of provide the right training, but then, like you said, to be able to measure the impact and continue to get funding for those kinds of programs that work. It's a great job. I love what I do, and I love the team that I have. But the work is never done. I mean, it's just, you cross one barrier and then you have to kind of start over. It's
well, when you're talking training and training providers, you're talking to us at PsychHub. I mean, this is what we do and live it every day. And, we struggle a lot about measuring and quality outcomes. And it's not even so much the measuring, it's agreeing on the outcomes. And it's a lot harder than I think people realize, because it depends on, what are you said earlier, one less suicide is maybe not the outcome, right? That might not be what you're measuring. And so a lot of things get lost in it. So we're lucky that we have smart people like you thinking these things through. And, people like to place blame, and we see it all the time. And these are not easy. These are not easy problems to solve. If they were, we wouldn't have them. These are complex problems. And as time goes on and we become more and more digitally connected and less physically connected, the issues become greater. We're all experiencing it in different ways, right? Everybody's kind of having their own emotional difficulties during all of this time. I know I have, and I know that a lot of my friends all have, and the people that we work with. Has that been? Yeah, I was going to ask you about your own personal journey about mental health.
You're right. This has been 2020 has been a challenging year, especially in the mental health field. I mean, obviously, some of the impacts you don't see right away. So I still think we're kind of waiting to know what the long-term impacts are going to be on mental health, on substance abuse, on domestic violence, on suicide. All those things aren't readily apparent sometimes, but certainly there's some warning signs there. I always say, when I think about like suicide being, kind of a good example of one of the outcomes that we obviously try to prevent, suicide isn't the problem. Suicide is someone's solution to a set of problems. So, so if you ask a person who's suicidal, tell me about your problem, they're not going to tell you suicide is their problem. They're going to talk to you about all the things that are they feel so helpless to be able to manage, and suicide is their solution. So I think that's why we have to start well before suicide, first of all, and I say that a lot. But in terms of my own personal journey, I mean, I spent 3 or 4 months working from home, which is weird when you think about you're doing this job kind of for the military, but doing it really kind of disconnected from people. I mean, a lot of what I do, and Marjorie, you know this, I still remember when you brought me that birthday cake, at NGB, when you came for a meeting, like it's relationships, it's forming friendships and bonds and partnerships and finding like-minded people who are in this with you. And so I think for me personally, this year has been really tough because we're not getting those face-to-face connections. It's hard to put your eyes on someone and really see how are they doing. Even my team that I work with so closely, we're on the phone almost every day, but I can't see them. I can't check in with them the same way that I normally would. So we have to be much more deliberate, I think, in how we approach that and really go out of our way to check in with folks, to set up these Zoom calls so you can see someone's face when you're talking to them. And but it's been a hard year, again, just on a personal level, but also just as someone who's responsible for kind of a strategic mental health approach for an entire military service, when everything that we're doing is in a virtual environment now. It's created some challenges that we have to continue to think about.
I'm glad you brought that up. I had a meeting with our team today, and I talked to them about self-care. We all talk about self-care, but I said to them, part of self-care is taking care of each other. Mm-hmm. And that, if we just pitch and talk about, self-care all the time, that puts so much responsibility on us to just have to do all the work to take care of ourselves. And I told them all today, I'm like, we're a family. We all have to be there to take care of each other. Just your point, to check in. And that's part of self-care, right? It's part of, like, we got to look out for each other. And it's a different time. I mean, I don't think I would have been in a situation where I would be telling that to a screen full of Zoom people. But
anybody could have guessed that. Yeah.
yeah. So this was so interesting. I know that our listeners are going to find this so interesting, and I'm incredibly grateful. I have, gotten to know and work alongside you for a few years now, and I've seen you just continue to grow and really, really dig into these issues, and you're not afraid of them. And that says a lot, because that's scary. It's scary to dig in on something or lean in on something when you don't have control over it and you don't know what the outcome's going to be, but you don't shy away from that. And we're all lucky, and we all hope that we can learn a thing or two about you as you go. And with that said, before we wrap up, do you have any, like, favorite resources to share, or anything that you like to promote?
Well, so I'd be, my team will be very angry with me if I don't promote our website, which a lot of the resources and projects and initiatives that I spoke about today, we do have more information about those. If you go to www.nationalguard.mil/WRF, that takes you to our landing page within our Warrior Resilience and Fitness program office. And so all those initiatives that I mentioned on, like, analytics, how we're measuring community impact to overall health and wellness, our innovation incubator, the programs that we're piloting right now, a lot of our training programs that are being offered to civilian and community level providers. A lot of that information can be found on our webpage. The other two, and since I don't know exactly who our listening audience is, I just want to make sure that folks know that there are some resources out there. I mean, if you are a veteran or in the National Guard or military, you have access to 24/7, 365 days a year, a crisis line that has trained providers on the other end of the line there to help and assist. And that's a 1-800-273-TALK. So if you call that number, you will get someone on the other end who is a provider who has been trained specifically to deal with those types of crises. So certainly if you're having any thoughts of self-harm or anything that could potentially put you or someone else in danger, just encourage you to reach out. Don't wait until something has happened that can't be reversed, but reach out and engage. And then the other resource, I think for military in particular, and within the National Guard, because there is such an inconsistency in terms of what people are eligible for, I like to always point out that Military OneSource is a resource available for any person serving in the military, regardless of your status, regardless of whether you're Guard, Reserve, active, inactive. So Military OneSource has counseling. They have lots of good information and resources there. And that can be accessed at 800-342-9647. So, again, lots of resources out there, but at the national level, we want to make sure that people know, no matter where you live, there are resources. You should engage, be familiar with what's available locally, look out for each other, check in with your friends and your family and your loved ones, because these are tough times. So we just want folks to be taking care of themselves and taking care of each other.
Thank you so much. Where could our listeners follow you?
I'm on LinkedIn. I don't know. I guess they could follow me on LinkedIn. My name, for those of you that didn't catch it, it's Matthew with 2 T's. Last name is Kleiman, Kleiman, and I don't think there's too many of me out there. So I'm happy to, if someone has questions about anything that I've spoken about today, relative to National Guard or the military community or some of the mental health initiatives that I discussed, happy to personally engage on LinkedIn, or there's some contact information on our website too. If you go to that website I mentioned, you can reach myself and some of our senior leaders within our team.
Well, thank you so much, Captain Kleiman. We're going to put those resources or those call-in numbers and websites, post them in this course of this podcast. And so thank you for helping to get the message out and helping to educate more people about the unique role that you play in our nation's defense, both at the federal level, but also at the state level. And everybody's seen you all deployed all over our country. Such great gratitude for the service you provide. And you don't get compensated for it, but hopefully you'll feel a sense of purpose and mission, which I think drives so many people into the uniformed services, and hope you certainly get that. So thank you and your whole team for joining us.
Well, thank you so much. It was really an honor to be on your podcast today. I look forward to talking to you all some more. And if you ever need anything, Marjorie, you certainly know how to reach me. And Patrick, it was so nice to meet you today.
Likewise.
All right.
What's cracking, Hope Nation? It's your friendly neighborhood Kevin Hines. And here's your Psych Hub brain health tip of the week. Take time, a few minutes throughout your day, to do resonance breathing. This clears your mind and helps you focus and remain calm. Shallow breathing can feel constricting, but deep breathing helps produce relaxation. Deep breathing is one of the best ways to lower stress in the body. You need to breathe in slowly through your nose until you feel air pushed into your belly instead of your chest. Then, when you exhale, breathe out very slowly from your mouth. This is my strategy for anxiety. It only takes a few minutes a day, and it can change your life. So remember, just breathe.
As always, thank you for listening to our podcast.
If you enjoyed the show, drop us a review.
If you haven't already, subscribe to our podcast for the latest episodes.
For the latest insights, check us out at psychhub.com.